Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Which of the following hormone is raised in polycystic ovarian syndrome? Luteinizing hormone is raised in polycystic ovarian syndrome. The hormone status of PCOD is there is increased, LH is increased and FSH will be normal to low and testosterone will be increased in polycystic ovarian syndrome. Then, true about polycystic ovarian disease is there is increased LH and decreased FSH will be seen, and also you will see hyperinsulinemia is seen in polycystic ovarian disease. Which of the following is the most likely diagnosis in 27-year-old obese women representing oligomenorrhea, infertility and hirsutism? 27-year-old obese women with oligomenorrhea, infertility and hirsutism is polycystic ovaries. In polycystic
thank you and thank you for watching.